Colin Hung with Healthcare IT Today, and I'm sitting down with Susan Kohler, SVP of Revenue Operations here at Greenway. Susan, welcome to the program.
Thank you so much. Glad to be here with you.
So Susan, before we got on camera, you were telling me a little bit about some of the staffing challenges that are really gripping this part of the industry. Can you tell me a little bit more about that?
Yeah, absolutely. It's interesting when you think about the great resignation happening, not only in America, but around the world, as they say, and it's really impacted service industry and hospitality. What people haven't realized, though, is in the healthcare industry, it's really impacting the office staff and those day-to-day people. When you go in and you go to see your doctor and you have that person meet and greet you, well, they're the ones doing all the back office work for the providers. Right. Well, they're feeling the strain and they're hearing about people quitting left and right, no notice, going to another place. So it's really putting pressure on our providers. When you think about it, they're trying to focus on patients, and now they have to be stressed and worried about hiring the staff they need for a critical function, which is supporting patients when they come in the office, but even more critical, submitting claims to payers and making sure they're collecting and being able to pay their employees, pay their practice, pay their bills. So it's a very critical function.
And because they're unable to hire this function, are you seeing any corresponding impacts downstream from this?
Oh yeah, absolutely. We're seeing where providers are untimely in submitting claims, and in the payer industry, you have so much time to submit claims. They don't give a lot of grace, and so now providers are starting to see decrease in revenue, where they now may have to let off staff, or they themselves go without a paycheck. So if you think about it, we're going through COVID, pandemic, providers really stressed, and now there's a further stress where they can't collect income and pay themselves.
It's like a vicious cycle almost.
That's right, that's exactly right. And so when you think about it, how do they approach that? And for a smaller practice, it's even more challenging to them because they may only need one or two people. Well, when do they now take the time to stop, interview, train, bring in that person? So it puts an added strain and stress on an already stressed environment.
And I'm assuming it's very hard to find these people in the first place, right? Like, it's not like they're just leaving and going to another job. It's just there's not enough of them around.
That's right. So it's a combination. There's not enough around. And then these small practices are now competing with larger revenue cycle management companies, where as we went into COVID, they realized, hey, we could do this work remote. So now I'm a small physician practice. I want you in my office, in present, doing the work. And you're competing against larger companies who say, no, you don't need to be in the office. I'm gonna let you work from home. And that person's like, great, I can sit at home. I'm in my pajamas. I have my dog with me. My kids are here with me. Why would I wanna go into a physician's office when I can stay at home? So now they're dealing with competing against other companies that are willing to pay them and let them stay at home.
So how's Greenway trying to help your providers or your clinics out?
That's a great question. So we've actually had our clients come to us. Hey, can you help us? We just lost 3 billers. We haven't submitted claims in a month. How can you help us? And that's where we step up and say, hey, we have GRS Select, which allows you, is there certain components of your revenue cycle that we can help you with? Maybe you need help posting payments. Maybe you need us to follow up with the insurance company. If there's small components of it, we can take that on for you. Then you may ask, but Susan, how do you find the staff? How can you do it? How have you solved the problem? Because I've had people ask me that. Well, then how do you solve the problem? Right. We solve the problem by looking at multiple sources to bring in our resources. So we're ramping up staff in our Bangalore office. We have 2 vendors working with us. So what I'm doing is dispersing the risk. I have 3 resources, pulling in the team members, training them continuously. So if one person leaves, I have 2 other sources to go to. So I'm not dependent on one company only maintaining my business. This allows for us to get to a stable place. Have we had some instability? Yes, I'll say we've had some instability, just like everybody has in the industry. But the key is, how do you solve for it? People's one part of it, though.
I was just going to ask that. So you're able to do things at a little bit bigger of a scale as well, right?
That's correct.
Because of how many customers that you're able to work with. So you don't have the issue of or you can allow for people to work in different places, and you can have a much bigger pool, and therefore divide the risk, as you just
That's
said.
exactly right.
But of course, as a health IT company, you must be bringing
Yes.
some technology to bear.
Oh,
on
yes,
this as well.
that's the key part of it too, is I've talked with our team that as an IT company, we have to be thinking not just about people, because there's always going to be a part of the process where you want people. Critical thinking, solving some of the problems for our clients, but you also have some repetitive tasks that we work through.
Right.
And so that's bringing in automation, bot technology, where some of those repetitive tasks, a bot can do the work, and then the exceptions are managed by the people. So as you think about that, you can really grow to scale in supporting clients, where if you have a large client who comes in and you might have otherwise needed 100 employees, you may be able to do the same work with 50 employees. So now you could hire 100 and put 50 on one client and 50 on another and turn on your automation. It's a great way to solve for some of the labor shortage.
As you look at revenue cycle and other areas of Greenway, what's sort of the most exciting for you?
I think the automation is the exciting part. I mean, we are in 2022. And when I talk to some clients, they say, but you can't go by just people. And I said, you're right. People should complement it. So we should use the technology to feed information to people. I had a great example where I was talking with a client, and they said, we implemented this artificial intelligence. And when we did that, one of the payers changed their rules, and within 3 days, the artificial intelligence told us, whereas previously, it would have taken a human being reviewing data and reports. It would have taken a month for them to see the trend.
Multiple rejected claims.
That's exactly right, and instead they saw it within 3 days. The AI said, hey, flag, there's a problem here. The person was able to say, oh, this payer now requires submission of medical records. I can now start doing that, and it prevents me from having all these denied claims and extra work to process those claims.
Let's think a little bit long-term now in this sort of revenue cycle space. You know, we hear a lot of the problems, of course, coming down the pipe with prior authorization, and how that's a little bit of a workflow issue, and has a definitely impact on patient experience as well. You know, we're starting to see a lot more patient pay issues and concerns and challenges. What are you seeing that's got you worried in terms of, or perhaps what are the opportunities you're seeing?
Yeah. I would say I actually see opportunity.
Okay.
The ONC is actually Office of National Coordinator, who regulates the EHR industry, is coming out with a RFI to get some information and feelings from payers, from the EHR, as well as practices in terms of standardizing prior authorization and incorporating those requirements into EHR. What's great about that is that's something that payers, providers, patients have been asking for since I've been in healthcare, and I won't talk about how long I've been in healthcare, but
it's only been a few years.
It's only been just a few years. But it's a huge problem. It's labor intensive. Every payer has their own form, their own requirements, and by getting to a standardized process, you say standardize the form, standardize the requirements. And now with EHRs adopting FHIR-enabled APIs, and the similar with the payers, you can now start sending electronic prior auths, and even better, work with AI companies who now have developed platforms that say, I'm going to use artificial intelligence that learns and knows what payers require. I'm going to extract the records you need to submit with the prior auth, because I've learned over time these are the documents and evidence you need. So now it takes less time for a person to package up the materials and submit it to a payer. Streamline the process, reduce the time, improve efficiency, and number one, gives the practices time with their patients rather than with the paperwork.
Susan, final question.
Yeah.
If I was a clinic manager or executive director of a practice and facing down a revenue cycle challenge, what advice would you give to me?
I would say don't use labor as your only solution. You need to understand that there's a lot of technology. Even if you don't partner with Greenway, you have to look at what the technology options are out there. Let the technology solve the small problems for you. Use your people for your complex, critical issues.
Excellent. Susan, thank you so much for the information you shared.
Absolutely. It's wonderful. Thank you for your time.